Good evening, everyone. My name is Yolanda.Francisco-Nez, and we are going to go ahead and get started. If we could have everyone who is standing find a chair in one of these circles here, and we'll get started. Thank you.
Good evening, everyone. Thank you for joining us. I'm Mayor Ralph Becker, the Mayor of Salt Lake City, and welcome all of you to our dialogue looking at how our community and our police are interacting, looking at things we have been doing, looking at hopefully what we can do to improve, whether that's in the form of community relations, whether that's in our training, whether that's in our policies. And I know that many of you have been participating in one way or another for a number of I'd say preliminary or other kinds of activities we've had around our community policing effort. I can tell you from my perspective, I cannot imagine anything more tragic as someone who would be a parent or a loved one who loses someone and goes through the shock, particularly where that happens in an officer-involved shooting. I can also tell you, those of you who were here at our session where we were providing information to folks about what our practices are and trying to establish the stage for the dialogue we're having this evening and in coming evenings, that is also an incredibly difficult and really tragic situation for the officer who may be involved in a shooting as well. And we're all human beings. We all, I think, are subject to both strengths and passions and foibles of our lives and of circumstances we face. And my hope is that as we go through these dialogues, we'll both become more informed. We'll share both our experiences and our thoughts, and we'll do that in a civil way so we can have a good discussion. And that as outcomes, as we have seen with some other major issues that the city has faced and addressed in the past, that as outcomes, we will learn how to improve our practices. And with that both our relationships with our community and our law enforcement officers and our public safety officials, as well as those of us who interact in other positions, whether we're a position of mayor or a city council member or otherwise, we can all learn to improve how we function better as a community so that we truly operate as close as we can to a community that is caring and inclusive and responsive in a way that provides protection in our community, but also is sensitive to the circumstances of members of our community in whatever situations we may all face. So I really appreciate all of you spending part of your evening. I know we're all looking forward to the dialogue that will happen this evening and in some subsequent evenings, and then taking the work that comes out of these efforts and helping shape a future that is one that reflects our ideals as a Salt Lake City community. So I'm pleased to have with me just in some brief introduction, because this is really about listening to you as our Salt Lake City residents and you who interact with us in the city, and learning from that discussion. But I believe the next speaker is going to be Chief Burbank, who's going to, I think, briefly address you and set the stage a little bit from the vantage point of law enforcement and training with law enforcement and our protocols there. And then the representative, the council member from this area, Aaron Mendenhall, who obviously has tremendous concern about how we operate as a city and the policies that we need to look at as a city going forward. So I'll turn time over to Chief Burbank, and again, thank you all for joining us, and I can assure you that all of us are going to be looking very closely at these discussions, these dialogues, and the outcomes that we can bring forward that really improve conditions for all of us in the community. So thank you.
Thank you very much, and I will be brief. One of the things that I think is very important is the fact that you need to hear from me how proud I am to participate in this community. When you look at some of the things that we have dealt with as a community, Occupy movement, the Charlie Square incident, officer-involved shootings throughout the year, D. Christopher, large immigration marches, and those events that occur in Salt Lake City, the thing that distinguishes us most from other parts of the nation is the fact that we are able to come together and address these issues in a peaceful manner. And that is both sides, because there was a grave mistake made in other parts of the country when the police show up wearing vests and helmets and driving tanks. There's no question that that says, here's what our attitude is, and then why would we expect anything else from the public? But when we can meet in the middle and have civil discussion and dialogue, it changes how we police and how we work together. And that is truly what has kept me in Salt Lake City, is because I think we're able to accomplish that. One of the things that I think is very important is your participation. And you hear lots from me on a regular basis. Tonight, I have with me several officers, and it will be their opportunity to hear and to participate. And so it will not be my intent to guide them, but to allow you to question them and hear some of the things that they do and where they specialize, which again is very important, because I am only credible if the people who work for me follow through on what I say. And that's very important. And I think I have excellent staff that participate with you in the way that I expect, and actually the way that you expect. Two things that I think are very important, and then I will sit down and step aside. One is the dialogue not only needs to be about how we train police officers, but what we as a community expect from a police officer in response to all kinds of different things. Policing has changed greatly over the years, even in the short time that I've been involved, 25 years. We spend more time being called to elementary schools, to high schools, to interjecting ourselves. And imagine the problem as we are called to situations, and you interject the police in situations that involve a myriad of things. We have one big hammer to deal with that, and that is the threat of taking you to jail or to juvenile court. There's a lot of other avenues that are much more effective that we need to start looking and evaluate. And should we be engaged, or should police officers be responding to these types of things? So that is very important to me, because if this community decides that it's traffic stops that leads to use of force, if it's this, then we need to look and say, we're not going to engage in that sort of activity. We're going to change the behavior of our police department and our expectation. One last thing that is very important, that is a difficult thing to understand, and that is the question that comes up time and time again, no matter where I speak or who I'm involved with, the discussion about why don't you shoot people in the leg or the arm? So you understand, the way the statute is written and the expectation of a police officer is, it is a last resort to use your firearm for any purpose. And you have to be able to say that your life or another is in threat of immediate death or serious bodily injury. If you are able to shoot somebody in the leg, the hand, or anywhere else, then it does not rise to the level that you should be discharging a firearm. And so it does not rise to that level, and I would be extremely upset and disappointed, and in fact would dismiss an officer if it did not rise to the level that they thought it was warranted, and they utilize that type of force. So it is an extremely difficult challenge, and it is also one that, when you look at the skill and ability of a dynamic, very quickly happening situation, is not often as easy as it is. So we'll talk a lot more about how we train police officers and everything else, but again, most importantly, thank you for your participation.
Hi, and thanks for coming out here tonight. I'm so happy that we have about every seat filled. My name's Erin Mendenhall. We're in District 5 right now. Salt Lake City has 7 council districts, and Lincoln Elementary, Whittier Elementary, Hawthorne, who am I forgetting? We've got East High School. So if you live in this area, I am your council representative. If you don't know who your council representative is, come talk to me. And I will tell you who, because the role of the council as a part-time elected official is to really be a liaison and to help in the conversation between our neighborhoods and our community and our administration and the departments that serve us. So I am your ally. I'm here to listen to you. You can email me, you can call me, come and talk to me and get my contact info if you'd like. But mostly I want to welcome you and tell you how grateful I am that we're here to have a conversation and have a dialogue. I appreciate too the way that Yolanda, who you'll meet in just a moment, set this up. I think that it's different than we had about a week ago when it was in the main library auditorium and in a bit of less of a dialogue setting, and I think it's quite brave actually of people to come and talk about a very difficult issue with all the lights on and looking at one another. So I hope that this conversation will lead to improvements that we couldn't even predict. There is always room to improve, and the council's role is to establish policy. Part of what we do is the budget, another part of what we do is establishing policy. So in some ways, the way that officers are trained has something to do with policy. The officers and chief will be able to tell you much more about how they choose what that training is. The council certainly doesn't do that, but we have a role in this conversation, and that's why I'm here tonight. I encourage you to be in touch with me or your other council members if you want to continue this dialogue in some way that you think I could be of assistance. So I'll turn it over to Yolanda now. Thanks.
Good evening, everyone. It's so great to have you all here and out tonight. Thank Mayor Becker and City Council Member Aaron Mendenhall, and also the Chief for speaking this evening. Now, this is the real meat of our program, actually. As we get started, we have a couple of presentations from our Salt Lake City Police Department, who are going to talk first about they call it CIT training, which stands for Crisis Intervention Training in Utah. As well, we have another presentation, very short, 10 minutes, that will be on the use of force training that officers receive. And from that point, after we have Mr. Coleman ending his presentation, then I will come back up again and talk more about what we plan to do within the dialogue setting. So now I'd like to turn the time over to our first presenter, which will be staff from Salt Lake City Police Department, Leanne Kendrick and Krista Dunn.
Welcome, everyone, and thanks for coming out this evening. About 15 years ago, I sat on a committee with the State Department of Substance Abuse and Mental Health, some representatives from mental health field across the state of Utah, the Salt Lake City Police Department, myself, and at the time, Assistant Chief Bill Shelton. And we were experiencing, at that time, much like today, a lot of incidents where we were dealing with subjects who didn't act like police officers expected them to when they came across them. And we were really trying to take a look at how do we train our officers and what do we train our officers to do in those types of situations. I was assigned at the time to go look across the country and see what was happening across the country when it came to dealing with subjects with mental illnesses, and especially those in crisis. And I traveled around to a couple of different places. I went to Seattle, they had a program there, and I went to a program in Memphis, Tennessee. And that program was called Crisis Intervention Teams. And I went through that 40 hours of training and thought, this is exactly what we need in Salt Lake City. Now, we don't have the same resources and things that they have there, but I think we can tailor this program to match what's being done in Memphis, because it was a great program. So I came back to Salt Lake. We talked with the mental health providers around the state. They were very excited about it, and we, in the beginning, thought, we're going to do this program for Salt Lake City, but what we came to realize is this is a need everywhere. So Salt Lake City took the reins, and we started this program on a grant of, what did we get, $25,000. We wrote a grant for $25,000 to start training police officers across the state on how to actually approach and communicate with those folks that are in mental health crisis. We sent officers to be trained, and we actually put two officers as the director and the coordinator of the statewide program. Officer Frederick is the coordinator for the statewide CIT program, and she's going to go over what we do and how we teach our officers. One of the things you probably should hear is for 15 years we've been doing this program. 9 years ago, when Chief Burbank became the chief of police, he said this is no longer going to be a voluntary program. Every officer we hire will go through this. And so now when we host an academy, when we host the Post Academy in Salt Lake City and our officers go through that, every officer is trained in crisis intervention team training. So Leanne's going to go over with you what that looks like.
Okay, I don't have a clicker, so I'm just going to point, and then if you hit the next slide, so next slide. There are 2 program goals to CIT. Again, CIT is Crisis Intervention Team. Has anybody in here heard of or had occasion to use a CIT member? Anybody? Okay. Just as a side note, we do have some brochures over here on the table. If you'd like to take one of those, either keep that for yourself or pass it on to someone. That does describe the program. It's the brochure that we hand out not only to all the students coming through our CIT academies, but out to the public as well. The first goal is to develop a network of CIT law enforcement officers within all Utah jurisdictions. We want this to be a network. We want to be teaching the same thing up north with the law enforcement agencies up in the northern part of Utah as what we're teaching in the southern part of the state. It is a true statewide program in that respect. Next slide. Second is to establish a system that includes law enforcement as a team member of mental health care. Historically, law enforcement and mental health had different agendas. With the implementation of the CIT program, we have been able to bridge the gap between mental health care and law enforcement and how it's applied. Next slide. The history of CIT, as Deputy Chief Dunn mentioned previously, Memphis, Tennessee started the first nationwide CIT program with Memphis Police Department and one of the colleges there. They developed the 40-hour curriculum. Next slide. Salt Lake City formed a committee, and in 2000 we went and had a couple of the officers go through that Memphis Police Department 40-hour CIT Academy and bring that concept back here to Salt Lake City, so we stole it from them. Next slide. We had our first statewide academy in the spring of 2001 in Salt Lake City. Next one. We very quickly recognized that law enforcement officers coming up from different areas, St. George, down from Weber County, were learning about the resources that could only be applied in Salt Lake. So we very quickly decided we were going to need to build a regional academy concept, being able to train the officers in their own jurisdictions, learning about the resources that are available to them in their areas. We did that in 2004 with St. George Police Department. We held our first corrections-based academy in 2007. The correction setting came to us and said, this is really great training and we appreciate being able to go through it. However, the correctional setting is really a different type of setting. Can you modify that so you can have the training be based for correctional officers? So we worked with Salt Lake County Sheriff's Office and the Utah Department of Corrections. We modified the curriculum and we held our first corrections-based academy in 2007. CIT is an international concept. CIT actually has a conference every year where law enforcement and mental health get together and we share ideas, new things that are coming out, new ways of new programs that are available for both law enforcement and mental health. And CIT International formed as in 2008. And the last CIT conference that we held in Monterey, California, there were actually a lot of different countries there. Switzerland was there, Canada was there, Mexico had representatives. Australia had representatives, so this really is becoming an international concept. We have a lot of international folks that come to us and say, how can we implement this where we are? Next slide. First CIT for youth training we held in 2011. In the 40-hour academy, certain blocks of instruction may only account for an hour or two of a certain concept. Youth-related issues only receive an hour in the 40-hour academy. We had a lot of our school resource officers that came to us and said, can you expand that? Can you give us more training on youth? And we said, yeah, so we branched out and held an 8-hour additional course. The prerequisite was that you had to successfully complete the 40-hour academy, then you could sign up for the additional 8-hour, and we held that first CIT for youth training in 2011 down in St. George, Utah. Next slide. Deputy Chief Dunn talked about the committee that was formed to put this all together, and you can see the folks. We worked very closely with NAMI, the National Alliance on Mental Illness. Valley Mental Health at the time was the mental health provider for the county, our own grants office, the department, of course. I do need to point out that this is not a Salt Lake City Police Department program. We administer it. It is a Division of Substance Abuse and Mental Health program. It's their program. We administer it for them. The benefits of CIT as we see them: reduced recidivism, better relationships between law enforcement and mental health providers, as I mentioned previously, more appropriate dispositions with street encounters, reduction in use of force. Consumers and family members report better interactions with CIT officers. Although we don't have any hard stats for Salt Lake City Police Department, I will put a stat out there that the Salt Lake County Sheriff's Office, the jail, came up with. In the year prior to CIT being implemented in the mental health unit at the Salt Lake County Jail, they had 60+ use of force reports that were filed. That would be anything from someone not wanting to get out of their street clothes into what the jail provides for them to an actual forced cell entry. So 60+ use of force reports that were filed. The year after CIT was implemented and required to work on the mental health unit at the jail, there was less than 10. So that's a pretty impressive stat, in my opinion, regarding the reduction in use of force. Yes, ma'am? We actually have tried in the past to get that. There's certain ideas that we have to, or certain curriculum that we have to put together, and it's very hard to measure that. It's not that we don't want to produce those stats. We actually are working on that, so it's a work in progress for us. So, next one. CIT Academy Objectives: increase officers' awareness of mental health issues and empathy of mental health consumers. And there is a difference between sympathy and empathy. We teach the individuals coming through the academy the empathetic approach. What's it like for a person that has a mental illness to come into contact with law enforcement? Instructing officers in effective techniques utilized when encountering mental health consumers. Broaden officers' knowledge of resources, which is very important. And assisting officers with providing a safer intervention and resolution for all parties involved. Next one. The CIT Academy, again, is a 40-hour course of instruction. They're introduced to the basics of clinical disorders. We talk about psychotropic medications. We talk about personality disorders. We attach that to the co-occurring disorder of substance abuse as a dual diagnosis. We talk about legal issues, suicide prevention, and special populations. The most important one for this, and the most positive feedback that we receive from the officers, is the site visits. The students are actually allowed to go down to the state hospital. They're allowed to go out into the community and talk with consumers and interact with them on a very low-level interaction. The instructors are professionals. We very quickly learned after the first CIT Academy that we had, not many law enforcement officers have social work backgrounds, so we asked the professionals to step in and teach the curriculum appropriate to mental health. There is a law enforcement instructor inside of the classroom at all times to answer any questions that may pop up. It is scenario-based training and testing. They are required to pass a written test, and they are also required to pass scenario-based testing. That was the agreement that we came to with the state. And as long as the individual can pass both successfully, they can graduate the academy. The CIT certification, again, comes from the Division of Substance Abuse and Mental Health. Most law enforcement training comes from POST, the Peace Officer Standards training. And this is very unique in that it does not come from POST. You can receive credit from POST. They do recognize it as a certification, but it actually comes from the Division of Substance Abuse and Mental Health. CIT program growth. It's going to take a second to pop up here, I think. We currently have CIT officers trained in 25 of the 29 counties in the state of Utah. 126 of the 147 law enforcement agencies have sent some personnel to our training. Doesn't mean that they are entirely trained, but it does mean that 126 out of those agencies have sent someone to the training. Over 3,800 of the approximate 10,000 law enforcement officers in the state of Utah have received CIT training and graduated successfully. 470 of those, or 470 separately, are non-sworn personnel, so support staff. We actually allow some mental health providers to come through as well, depending on what their connection to the program is. Salt Lake City has 345 personnel that have been through the CIT Academy since its inception. I'm not sure what our total number is right now.
We have about 550 employees, 427 officers.
And did you need to add anything else, or? Okay, does anybody have any questions right now? Yes, ma'am. Yeah.
We have police officer that's first on site.
You're wondering why we aren't trained in the medical side?
At least because it's usually the officer that's there first. I'm wondering why you excluded any sort of medical issues.
And if the officer encounters someone that appears to have some kind of issue, same type of thing, they can still use this training for that as well.
Thank you.
Well, my biggest question is it working? And since you don't have any stats, it's hard to say that. And I see Salt Lake officers having lethal force at a higher level than some cities like New York City. We're having like twice as many shootings as New York City, a city hugely larger than Salt Lake. So what's going on here? Can you answer that?
I wouldn't necessarily say something's gone wrong. What I would say is it's infinitely easier to measure a population like corrections because you have everyone there in the same place and they're not moving around. You're not dealing with different people all the time. Out in our population, we're dealing with different subjects every single day. Some people are repeat offenders, yes, but it's infinitely easier to measure a controlled population, which we don't have. But as far as that goes, yeah, we probably do need to do something more with that, and as Leanne mentioned, we are working in that direction. You know what, we're going to allow you to ask some more questions when we get into the circles, but we need to move forward, so save your questions.
Thank you both. That was great. Can we all give them a hand? We realize that's just a short presentation, but I want to go ahead and turn the time over now to Deputy Chief Jim Coleman, who will give us a presentation on the use of force training. And after, there will be no questions, and so we can get the dialogue started. Thank you.
All right, I have my marching orders apparently, so I can live with that. Good evening. Thank you for coming. My name's Jim Coleman. I am the Deputy Chief Commander over what we call the Management Services Bureau, and one of my commands is the training unit and the Salt Lake City Police Academy. It's a great job, very important job. We all like to say our jobs are the most important, but mine really is. So with that being said, I want to give you what they call a 30,000-foot view of training, because we're going to need to talk about it specifically in the groups. It's just too big of a topic, use of force training, because it touches virtually every part of police training. Next, please. So let's talk about the police academy first, real quickly. Frequently I hear, what is the policy on use of force? But the way we need to look at the way we train police officers and the way we hold them accountable is it's a four-pronged approach to use of force and its training. We have constitutional and statutory limitations. We have, boy, I can't even see it from here, sorry about that. We have our policies and procedures. Councilperson Mendenhall talked about city policy. Of course, the police department, we get more down into the weeds, but what the public wants, what we feel are important, what we feel is important in our community certainly should have an impact on our policy. We do the practical application, the training, the running through the scenarios. That includes the tools we use, that includes physical force, that includes decision making as to when to use force, when not to, when to wait, those kind of aspects. And then finally, you would expect, and we do testing and evaluation. Testing occurs frequently in the police academy, as does evaluation, but evaluation seeps into post-police academy. Your officers are out there working in the street, and that takes place in areas such as internal affairs. Is this something that the officer has most of the responsibility for, or did we have a gap in training? Or is this something we didn't anticipate and we need to adjust our training for it? Those are the things we're looking for. Next, thank you. There are some other inputs. We have to follow closely the Utah, by legislation, we have to follow the Utah Police Officer Standards and Training Model. Much of our curriculum is required by them. Department philosophy, it changes. It changes with the times, it changes with input like this. We take that into account. It's what makes, what would make Salt Lake City different than another city in the valley, another city in the country. Our training officers, highly qualified from both being on the street and from spending hundreds of hours in the classroom themselves. When they teach something, they have to learn it. Then they have to practice it. Then they have to spend several hours preparing to teach others. Technology, that speaks for itself. And it wouldn't just be, I'm not just talking about technology such as tasers and cameras. I'm talking about technology that teaches officers, interactive equipment, things that help us save money, save time, build in efficiencies. And then contemporary issues. That's why we're here. I've got to take this back, right? We've got to do better. If we ever say that we've got it down and it can't be better, we need to be replaced because we're not training officers anymore. Next, please. Okay, so we graduate from the police academy. We continue the training. We call it in-service training. The great thing about in-service training is probably what you do at your job. Once you have some experience, when you come back to the training officers, it's not simply a one-direction conversation. The training officers get feedback. There's problem solving involved within the classroom, talking through scenarios, kind of like you might see a football team doing at halftime, something like that. In-service training, as you can imagine, we are inundated with opportunities on topics. We have people trying to sell us technology, trying to sell us their expertise. So we constantly evaluate that. And then finally, we prioritize. Priority is going to be, sometimes it's going to be a financial priority. We get a break on some training. But more often than not, especially in the information age, prioritization comes from things that are currently happening nationally and locally. We try and be ahead of the curve. I would like to think that most of the time we are, but I would not be truthful with you if I said we were always ahead of the curve. Always have to be learning. I have a dozen copies of this. I've been in training 3 times, not retraining, not punishment, but although that occurs. But I just want to, this is a national depiction of the use of force decision-making process an officer goes through. I have the copies because this could take the whole 10 minutes to walk you through it. But you know, if you're able to see it, I understand, I can see the words are small from here, but really what it emphasizes is that inner gray and black circle is the officer is constantly evaluating the situation. At one point, they may feel like things are very calm, and it's going to just be conversation, and we're going to solve this problem, going to give maybe a little advice, move on to the next call. But it can quickly move into an area where an officer needs to take action. That doesn't always involve physical action. It can be as much as, you know, explaining to somebody what the law is and what their, you know, what the consequences are. And then, of course, it can move into a very aggressive action. But what I would point out to you here is the light blue area that starts off in the upper right side, the yellow. Those are the verbal, those are the presence things, and only a narrow slice of that pie gets into the most serious forms of officers' use of force. Next, please. So what are we trying to accomplish when we teach use of force training? You know, to me, it feels like a field experiment where we've got all these variables, and we have to sort through what's cause and what's effect, right? So I think I know the public really appreciates and understands how difficult police work is. That is not an excuse, it's just a reality. So what it boils down to in this analogy is we have a ton of variables anytime we go somewhere. So we got to take two approaches. We got to train our people to use their skills in those known variables. You know, do we have intoxication present? You know, is this a place, you know, like a kitchen where there are a lot of potential weapons, things like that? Should I be waiting for another officer to get here? Control the known variables, and what we try to do in training is prepare officers to respond to the unknown variables, the things that happen like that. And to respond, most importantly, appropriately, okay? Tough but not impossible job. Next. We're all invested, aren't we? The officer safety, the public safety, when we send an officer there, we're invested in the officer's competency. If you call an officer because you were burglarized, you would hope that we send somebody competent enough and skilled enough to have a chance, a higher probability of getting your property back. And we're all invested financially. Not just what it costs to train an officer, but the liability that we as taxpayers bear when things that should have gone better don't. Okay. I just want to, how am I doing on time, Yolanda? 2 minutes, okay, quickly. I know we can stand up here and it sounds like we're defending everything we do and we don't need any input and everything's perfect. And you know, I think what we're trying to do in an honest effort is to say, you know, we're not blind to this, we're working on it. But we do have to work on this. And we've got a lot of work in some areas to do. I just wanted to give you a small example. In the 1970s, it was a particularly dangerous time to be a police officer, the most dangerous time in the history of our country. And we had some police agencies who became very renowned for teaching officers how to deal with that danger, how to survive. Well, are there any brain surgeons in here? Okay, so you're just going to have to trust what I'm going to tell you. All right, so that instinctual fight to survive process takes place in a part of our brain called the amygdala, okay? The problem with touching that part of our brain is that's also where fear and doubt reside within us, right? It's instinctual. That relates directly to fighting and surviving, fear and doubt. When am I in danger? Can I overcome this? What should I do? Fight or flight. We've all heard that term before. Okay, well, how does that look when we train to that, when we touch on that area too much? It's what we see, hypervigilance. We see when a police officer detects noncompliance from somebody, maybe somebody pulls away as they're trying to handcuff them, that becomes a mortal danger. They become fearful and they have to act quickly. Tunnel vision. They seek your cooperation by instilling fear, okay? Maybe that force will be used against you. It creates an us and them mentality, all right? How does it look from the other side? The person that's interacting with this person that's full of fear and full of hypervigilance looks like arrogance, looks like disdain, self-righteousness, and and unapproachability. Does that sound like a cop to you? All right, we got work to do, right? All right, last slide. Okay, I'm sorry for the smallness of this print, but we've got to take action. The kind of things we need to do are, there are very important things that happen in the amygdala, for example, that help us do our job well. It gives us courage, it gives us decisiveness, it makes us problem solvers in very deep crisis. So how do we teach people to adapt this idea of unconditional respect? That's how let me put one more analogy out there for you, okay? A horse and a jockey. The horse has all the physical skill, the ability, the grace to do these things, but it's running in a field untamed if you don't have a jockey on the back. Okay, the jockey decides when it's time to put all those elements into play. That's what unconditional respect means. It means, we treat everybody the same, okay? And only when we get the input that we need to use these things that we've been trained to do, only then do we start to consider them, do we start to look for other possibilities, break our tunnel vision, and look for other possibilities. That's what we need. And what will it do? Well, it will help the officer, but hopefully it also reduces things like bias, prejudice, and prejudgment. So these police departments that used this type of training, what they found was, yeah, it kept officers safe, but nobody wanted to deal with the cops anymore because they came across as arrogant, disdainful, and so on. So just one example. I wouldn't say it's the key. I wouldn't say it's the only one. One example of areas we need to look to try and improve. Thank you.